Uh, Thank you, IMA Maharashtra State and President and all office bearers of IMA NANDED. It's always a pleasure coming over here and talking to you all and enjoying your hospitality since yesterday. Thank you. So the topic given to me was MMC and NMC, which would take more than one day. So I am just sticking to the latest, because majority of you all have heard me somewhere or the other talking as far as MMC is concerned. But what is going to come and hit us is the new NMC Code of Ethics of 2023. So I'll stick to that, and what is relevant part, even that also, it's a huge document, but I'll stick to the part where, which is directly going to affect all of us in our day-to-day practice. So, under the NMC, there are 4 boards, and one of the board is the Ethics and Medical Register, EMRB as it is called, which is basically responsible for registering you and dictating what are the ethics that you have to follow as far as National Medical Commission is concerned. So they basically maintain a national register. So all your names, even if you're registered with the state medical councils, automatically it is also registered. As of today, it is registered with the National Medical Commission, but these are going to change now. Then professional conduct, promote ethics, bring in new ethics, and ensure the compliance of the code of professional and ethical conduct through the state medical council. So today, we have our own ethics in the Maharashtra, under the Maharashtra Medical Council, but once the NMC Code of Ethics is notified, even in Maharashtra, we will have to follow whatever is written in the Code of Ethics. And of course, appellate jurisdiction. If you are not happy with whatever decision the Maharashtra Medical Council has taken against you, this is the first appellate is going to be the EMRB board. So what happened? NMC formed its own Code of Ethics 2023. And the notification came on 2nd August 2023. It was directly notified, and it was called as the National Medical Commission Registered Medical Practitioners Regulation 2023. It was notified. There was a lot of hue and cry after that, especially from the organizations, because of some provisions which were absolutely detrimental for our day-to-day practice. So we went, even IMA went right up to the ministry level. We had meetings with the Honorable Minister also, and the Chief Secretary over there. And for the first time, they had to withdraw this notification on 23rd of August. So within 3 weeks, they withdrew this, because even the ministry thought that yes, there is something wrong as far as this notification is concerned, and therefore we are withdrawing this. So this was kept in abeyance. Remember, keeping in abeyance, that does not mean that the whole thing is scratched off. It is kept there. It is a sleeping giant who is sitting, may wake up any time. So as of today, we are governed by the MCA Code of Ethics 2002. Now, ethics is a very dynamic process. Unfortunately, our administrators, our regulators move so slowly that in the last 20 years, they did not feel it necessary to change whatever was written in 2002 as far as ethics is concerned. That's what NMC tried. Unfortunately, their thinking was misplaced, for which they had to withdraw this notification. So as of today, as I said, we are still governed by the 2002 Code of Medical Ethics. First thing that they have said is that you have to generate your own unique identity number. See, today when we are practicing in Maharashtra, we write the MMC number on all our certificates and all our papers and everything. That is going to go in the future. You will have to go on the NMC website, fill up all the details, and they will give you a unique identification number which will be there for everybody all over India. One way it is a good thing, because then you'll know exactly how many doctors are there all over India and where they are practicing, which as of today, even on the floor of the House, the ministry has agreed that they are not aware of the exact doctors, because Suppose someone is practicing on the borders, say Maharashtra and Gujarat. He practices in Maharashtra and he even goes and practices in Gujarat. He takes a number in Maharashtra Medical Council, he takes a number in Gujarat Medical Council. So there is duplication because he gets two different numbers. All that will go in the future. You will have a single number wherever you go and practice and you register in that state. Only, just like on our car registration where you write MH, GU and all that, similar that will come after your number, but your basic number will remain the same. And you are supposed to use this number in all official documents. Next is going to come, which was a demand from IMA also, foreign medical graduates who get that MD degree, though they have done MBBS course only over there, and they come and practice here as consultants in India. No more that will be allowed, because you will have to practice exactly what you have learned, even if the degree is given as MD, and this is the court judgment also. In Maharashtra, we have got that even on the certificate, if you write MD degree, the Maharashtra Medical Council today is writing equivalent to MBBS only. So you are only allowed to practice as an MBBS. Then of course, unqualified persons, you are not allowed to work with them, especially if you are doing any procedure or anything. And this is basically a wake-up call for all our members who have, Ayush doctors who are working in their hospitals. See to it, nowhere on the paper it appears that they have done anything for the patient, because you will be in trouble with NMC if they do that. Because ultimately the vicarious responsibility is going to be yours. CPD is something that was there in Maharashtra, and all of us are used to this, of doing 30 credit hours in 5 years for a renewal. Now this is going to come. They have taken the same thing that we have done in Maharashtra. The whole thing they have picked up, because I have myself given I was in NMC also. We have given them all the details. So it is going to be compulsory today, once it is notified all over India. So you are going to get a unique number after every 5 years. In many states, there is no renewal as such, which is absolutely necessary, because the councils do not know how many people are alive, how many have left the state, how many have left the country and are no more practicing over here. So this renewal after 5 years, we can know all these details. It is going to happen, and you will have to do your credit hours. Just keep a watch on, all this L2, L1. I forgot to tell you that. In the end, I will tell you exactly what the L1, L2, L3, L4, what it means at the end of in the last slide. Another very important aspect that we have been able to put, as far as when I was in the NMC, I was in this committee which was formulating, is the right of remuneration, which was not there in the old code of ethics, right? So today, an RMP, many a times patients come to us, they say that, no, you treat the patient, whatever it is, whatever the cost, we will do that. After 4-5 days, when the bills start increasing, they say, no more, we have the money, now we cannot afford to pay. Document all this on your paper, write all these details, send it to the local authorities, that means whoever has given you a registration, that hospital or this, and you can refuse further treatment to that patient and transfer him to a government hospital or some other hospital. That right has been given to a doctor, because as a professional, it is your right to get remuneration whenever you are treating these patients. Soliciting patients, which was there in the old also, same thing continues, but what we have added now is, because there was no level playing field, what the state council says that I can take action only against those who are registered with me. That means individual doctors. But today you're having corporate hospital, you're getting institutions, you're getting standalone investigative institutions which are there, which are left, right and center. They are soliciting patients, advertising and everything. And therefore, it was the demand of ordinary IMA members that there is no level playing field. So we have tried this time to bring all institutions along with the RMPs, that is the registered medical practitioners, institutions, organizations, hospitals, nursing homes and corporate hospitals under NMC as far as this code of ethics is concerned, of prohibiting, soliciting and advertisement is concerned. Prescribing generic medicines, I have put it in blue because this was one point which we had absolutely opposed in the old one and because of which it was withdrawn. Today, as you are aware, generics in India is not the same as you get in Europe or you get in America, because the FDA is not that strong at all. Just about 15 days back, you must have read in the papers, in one municipal hospital in Mumbai, when they checked the drug, they found that it was talcum powder. So if it can happen in a government institution, imagine what will happen outside. And ultimately, who's responsible? You may do the best diagnosis, all investigations, but when you write the treatment ending with the patient and the patient goes and buys talcum powder, he's not going to get all right. And who's going to get blamed? It is a doctor who's going to get blamed. And therefore we said, unless, means IMA said that unless you make the FDA as strong as it is there in the Western countries, there is no way that we are going to prescribe purely generics. And the second question we ask them is, if you're asking doctors to purely prescribe generics, then how are you giving the pharmaceutical companies to prepare these branded drugs? You should not allow under your act, you should not allow them to give branded drugs at all. Everybody let it make generic drugs only, and we will prescribe generic drugs of that company. Fee splitting is again something I think all of us are aware. Commission is not allowed. It was there in the old Code of Ethics also. Now there is restriction on advertisement. At first there was restriction completely on advertisement. We believe, at least I believe that there should be what is called as ethical advertisement allowed even for doctors. It is happening all over the world. And especially in today's era, which is completely dependent on advertisement, why shouldn't the doctors allowed to do that? For which I had given a presentation also, which was accepted by the National Medical Commission. Unfortunately, it was sent forward to the ministry, and somewhere there it was, why it was held on, I don't know, but it has not come. So I hope that presentation in future is accepted by even the ministry. But yet we added one clause over here. Initially, if you see the Code of Ethics, it said that you are allowed to advertise in these 7 issues, but it never said to what period. Are you allowed to advertise only one day, once, 1 month, 1 year, what? Nothing was said. So now we have put that 3 months you are allowed to advertise if you are changing your practice or you are closing your practice or starting new practice, etc., etc. One step ahead, of course, luckily NMC has gone, and today you are allowed to advertise as far as putting your announcement in the lay press, but these should not contain anything more than the name of the institution, the type of the patients admitted, kind of training and other facilities offered, and your fees. So these you are allowed to advertise as of course, wait for the notification, not as of now, because we are still under 2002. So once that notification comes, you will be allowed to do at least these you will be allowed to do, so that the patients in your area know what type of service your hospital is giving, which today they are not aware. And many a times the patient go to the wrong hospital or the wrong doctor or whatever it is. Sale of drugs is nothing. It's another thing which was a big issue, especially with insurance company, coming into our field, exponentially increasing. What was happening is, according to the old Code of Ethics, you are not allowed to sell drugs to your patients. That was written very well. Means you cannot have a shop and all that. But then what about the insurance companies? When you are giving the bill today to the insurance companies, when you write the medicines which are used, the insurance company demand individual medicines used and how much you have charged for that medicine. All of us who have hospitals know that. So this would go against the Code of Ethics which is there at present. So this has been put now that you will be allowed to sell medicines to your patients only. So it will not be an open shop like a pharmaceutical company for which you require, for a pharmacy which will require a license, but you will be able to sell it to your patients. That means officially you can put in the bill that these medicines were given and this was charged for the medicines. You will not be hauled up by any council. Then of course, How long do we keep medical records? This is something which everybody asks every time. The MCI has said that, and NMC continues saying that it will be 3 years, but they are only saying it for the IPD, indoor papers. Nobody is talking about the OPD, but then personally I would also request you keep the duplicate copies of your OPD papers also, because that's another talk itself, because it's very important for you, because patients sometimes hide these OPD papers where you have written instructions. So keep those details with you. Another aspect that may change afterwards, as you know today, within 72 hours you are supposed to give the papers once the relatives or the patient asks for it, right? Now sometimes in a heavy practice and in a hospital which is quite heavy, it becomes very difficult to give all these things. So now what NMC has said that within 5 working days you can give it. And when you say 5 working days, it means 1 week, because 2 days holidays. So you get time during the holidays where you can prepare this patient. So this is something good as far as we doctors are concerned. Certificates is another thing. How many of us who give certificates really keep a duplicate of that certificate? Hardly 1 or 2 maybe. Okay? So get into the habit, because certificate is a legal document, remember, can be used in the court also. So you should have the duplicate with you and whom you have handed that certificate. Social and electronic media, which was not there in 2002 Code of Ethics at all, because at that time there was no social media at all. This has come in a big way now. So NMC has also made rules, regulations almost similar to how it is for the physical. But of course, the important aspect over here that I would like to tell you all is, please do not tell your patients to write testimonials for you. You know, this is the best surgeon. I went to 10 different doctors. I was not cured. I was suffering. And then when I came to Dr. Utture, within 1 consultation, he made me all right. All that they put on social media, and many a times you and I know how it comes on the social media. This will not be allowed as far as social media. So no likes, followers, paying money, so that search algorithms, you know, you have these platforms which are there, where if you pay them money and a patient goes online to find out the urologist, say in NANDED city, you find that 1, 2, 3, 4 it comes. And invariably that 1, 2, 3 have paid money. That is why they come 1. So even that will be not allowed. So there is going to be a clamp on these platforms which are there going to be in the future. Yeah, you have your own web page you can have, but there are guidelines which have been put up, that is in the annexure. I won't go into all that detail. So even through social media, you cannot solicit the patient. That is also written, just like it is in the other things also. Consent is another thing I think all of us have to get used to, and that is that as of today, informed consent, and informed consent only. We were taking up till now what we used to call as real consent. Okay? Which before that, it was, I still remember in my residency days, we used to write, I am willing for any operation under any anesthesia. That is all that was written. No, it is going to be informed consent. Many a times my colleagues ask me, why, how can we write all these details? I simply tell them that if you go to any bank, take a loan, you go for a car, they give you a thick booklet like that. We never read it, but we sign on everything. So have a thick booklet, let the patient sign. So at least the patient can say it was given to him. So if for money's sake they can do that, I think for your peace of mind, you can definitely do that. Then of course, you can choose whom you want to treat. That is another thing that is allowed to you. So if, you know, many places there are doctors group, which if patients are violent or anything, they put that name on the group. And you find that patient has come to you for the first consultation, you can refuse seeing that patient. That is your right. Of course, unless it is an emergency, which is a Supreme Court judgment. That is a different thing. But you can refuse seeing that patient. But once you see that patient, then you cannot refuse. Then you have to keep on treating him. It is as simple as that. Not only that, if the patient afterwards also becomes abusive or causes damage to you or your institution, you can refuse treating that patient after documenting the everything on paper and sending it to your local authorities. Your RMP's name, NMC number should be on everything, all your official documents. it should be there. No gifts, which is there, I don't know, but things are still day in, day out, we are seeing it is happening from the pharmaceutical companies. Doctors are still accepting that. Please do not do that, because what is going to and may come if this is passed, that the NMC will have a right to ask for your financial records of last 5 years to find out how much money you have received from the companies. So pharma companies, be very careful what you do. Then of course, there was no moratorium on after how long the patients can complain against you in the council. But now it is there, 2 years has been put over here, even in the state councils and in the National Commission. And another thing is, patients used to, especially we were seeing that in MMC, patients used to complain against the doctor but never come for the hearings. 1 hearing, 2 hearing, 3 hearings, and it was getting postponed like any other court. That will not be allowed. We had done it in Maharashtra. We had taken the decision and we said 2 hearings, if they don't come, ex parte we will give the decision, and we used to do that. Same thing now they have copied in NMC also. They will be allowed only 2 turns. Otherwise ex parte decisions will be given. Complaints, initially it was only that there was a warning, suspension for some period and total suspension or cancellation of registration. Now if you see, there are all these punishments can be given, which is a good thing, because depending on what you have done wrong, on the gravity of that wrong, you will be given these punishments which are there. But what I had objected to, I think even IMA had objected to, is over here. Number 7, award of monetary penalty to the aggrieved party. Already CPA is there, civil courts are there, criminal are there, in which we are paying the patients if there is negligence. Now you have one more forum which can decide that you want to. This is also what we had objected to. I hope they remove it whenever it comes in the future. Appeal, you go to the EMRB, but you have to do that within 60 days. If you are not happy with EMRB decision, then you can go to the main NMC, again 60 days is concerned. So suppose the State Council says you are suspended for 1 month. That suspension will not start for 60 days, remember, because that is the time period given to you for appealing. The period will start after 60 days if you do not go in appeal. So the levels which I told you, L1, L2, L3, because they were finding that different councils were giving different type of punishment for the same infraction of duty, right? So now it is written over there that there will be levels over there. We saw 1, 2, 3 written in all the sections. 1 means, again, it is a warning. Second is that if there is causing direct harm but not conclusively proved, then it will be suspension for up to 1 month. Causing direct harm and conclusively proved, it will be from 3 months to 6 months, 3 years. And then if in very rare cases, you can be permanently, your license can be taken off. But this is very, very rare. Even those details are there. I will not go into details of all those things. So remember, please go and read, at least today, your Code of Medical Ethics 2002. How many of you all have really read it? Because that is what is basically, I can understand those who are medico-legally into that field, but rest of us don't read it, because that is what is now governing you. And also the draft NMC is there. Please go through the draft NMC, because this is going to be again kept in the public domain before it is notified. And we as IMA have to take objections to the clauses like how we did in the past, so that do not come, because once, remember, it comes, it is very difficult to take it back again. So thank you very much for your patient hearing. Thank you.